is the 24th of September 2025. A cold day indeed from the capital of the country, right here in Nairobi. My name is Simba Elijah Charles Kiaga. Thank you very much for choosing to begin your day with us right here on Look Up TV. We have a jam-packed session for you. So let me just give you a snapshot of what you expect today then in terms of your weather updates. I mean, in Lavington, where our studios are located, it's currently 15. Ooh. By the way, those are July numbers for any other person who's really interested in knowing how the climate has changed this year. It feels like 15 degrees Celsius this morning. No sun has come out. If you're expecting for it to come out today, I don't think it has come out. I do have reports that some parts of the city, it rained this morning. So again, just like we say, if you are on the road, the schools are still on, universities are still on, unless you are in Litain. Boys, that's cool. I'll be telling you much about that this morning. You are on the road traveling to your places of work. So all the drivers, make sure you arrive alive. That's exactly what is important this morning. And I can see the highest, according to this, today is going to be 26, but I don't know what time that is going to be. The highest for tomorrow is 28. But these predictions from our weather apps really don't come to a reality, because even yesterday, we didn't really see much of the sun around Nairobi. Oof, so cold days indeed. And we do expect that the short range should be up and running. If they are not, it's also another worry then for farmers across the country. Good. We have a lot that we're going to discuss this morning, just a snapshot of whatever it is that we're going to talk about this morning. It's about our mental health state as a country. As it stands, we do have a mental health crisis in the country. And this is from rising cases of depression, anxiety, suicide, and substance abuse that is stretching families, schools, and workplaces. Now, according to the World Health Organization, 1 in every 4 Kenyans will experience a mental health issue in their lifetime. Yet stigma and lack of resources keep most from seeking help. That is something that we need to talk about. It's a big crisis in the country, where 1 in 4 would face a mental crisis in their lifetime. But when you look around and talk about our mental health facilities in the country, we are not really that ready to have that conversation in its entirety. So this morning, we cast our outlook on this particular area, talk about exactly what we need to do as a country just to make sure that we are ahead of this mental health crisis that has befallen the country. It's well known, but the remedy has never been achieved in this country. We do have a counseling psychologist who's going to walk into the studio this morning so that we have this conversation in its entirety. Fantastic. So get talking to us at Look Up TV across all your social media platforms. Let's then take a look at what it is that you're waking up to this morning in terms of on your dailies this morning. And as usual, let's jump into the Daily Nation. A lot of stories here that we have to look at this morning. And this is exactly how they begin. We are a nation in crisis. And also this morning we talk about a mental health crisis. Let's see if indeed our conversation is timely, going by the headlines here from the Daily Nation. On health, this is what they're saying. Private hospitals turn away patients unable to pay cash after cutting credit to SHA, citing past deaths. Tutors and police face denial of services. Ooh, not so good indeed. When you're really looking at this one, we had a conversation about it yesterday, even when we were talking about those promises that teachers were given by the President of the Republic of Kenya, that is Dr. William Samoei Ruto. Now this is another one, and if you read the story, by the way, in its entirety. You'll find that even SHA officials now are sending officials who are purporting to be patients to the RUFA associated hospitals, and these are the hospitals that would essentially treat police and teachers in the country, and then try and see which hospitals these are that are not giving the services to the teachers and police in the country. And we do know why they're not doing that. From NHIF to SHA, there is a 33 billion shillings worth of death that was owed on that platform that was not paid to hospitals across the country. So hospitals are now saying, we are not going to keep on onboarding patients on the SHA platform if we are owed debts that are up to the tune of 33 billion shillings. And that's a lot of money. That's one area. Education. They're talking about learning in a public university is paralyzed after lecturers went on strike to demand 8 billion salary arrears. Schools are also in a cash crunch. They just declared that strike off last week after proper negotiations or emergency negotiations went into the government and OASU. And that doesn't stop the fact that indeed we did experience a couple days when public universities in the country were not in proper cycle of learning. That's another crisis that has been earmarked by the Daily Nation. Counties as well. Now, thousands of employees are going without salaries, with the devolved units blaming the Treasury for delays in release of funds as well. Now, here's the story that has been covered on page 2 and 3 of the Daily Nation. You're going to read a story on it and then see exactly what the crisis this country is walked into as we start the final quarter of this year. Good. Now, story on page 4 and 5, queries on how tycoons bagged 15 billion shillings rice import tender. And this is one that it's actually barely a year after a food import scandal rocked the Kenya National Trading Corporation, KNTC. The agency has hired 4 farms to ship 250,000 tons of white rice under unclear circumstances, elbowing out 16 others that were initially contracted. All right, the government revised its valuation of grade 1 white Pakistani rice to $460, all right, which is around 59,409 shillings per metric ton, which means the consignment awarded in 4 contractors is valued to be approximately 14.8 billion shillings. Now remember, there was an uproar on how KNTC, by the way, this is quite a new entity that looks into food importation into the country, and this one is another one as well. Why they revised 16 other contractors who've been given this contract initially to bring in this rice into the country. Again, another scandal probably that is booming in KNTC. That story has been covered in page 4 and 5 of the Daily Nation. So probably now to a good story on the Daily Nation this morning. Grand reception for Kenyan athletes who were just competing at the Berlin Marathon. All right, they just came yesterday. They were given a proper reception at JKI from World Athletics Championships yesterday, and you can see pictures right there of Liliana Odiva, women's 800 meters gold medalist, all right, who's being lifted high as they arrived into the country from Berlin. Congratulations to them, because they put Kenya second in that competition in terms of the medals that were received in all the races competitions, all of them. All right, we swept medals in them. Proper achievement right there. So let's also talk about page 7 story. You're going to read about how Matiang'i is in talks with the Uhuru Party leaders. Now, former Interior CS Fred Matiang'i met Jubilee officials yesterday ahead of the party's special national delegates meeting that is scheduled for Friday. That story has been covered on page 7. This is just in the running for the 2027 elections. And we do know that, by the way, ODM this week is going to hold its party primaries. But we need to see even if they're going to be peaceful, because in the past, we've seen skirmishes that have rocked the party primaries for majority of the parties in the country, especially ODM. But on page 10, you're going to read a story on how families are now suing state of a fire that killed 21 boys in Nyeri. That story has been covered on page 10, and 10 family members have been affected in this fire. Now, backed by the Kenya Human Rights Commission and the Elimu Bora Working Group, the families accuse the government and owners of Hillside Endarasha Academy of neglecting safety measures, leading to the tragedy on the night of September 5th, 2024. By the way, we saw gory images and that start stories that came from Endarasha Academy at Hillside. And so hopefully the families can get justice on this particular one. All right, let's cross over to the Standard this morning. Let's look at the stories that are also been covered on the Standard. There's a story here, and you can see this picture here of the president and one former Prime Minister, Raila Amolo Odinga, and they're saying playing Ruto. And that's the headline. And this is the kicker, that Raila Odinga's shifting signals have thrown ODM into a turmoil, leaving allies baffled, opponents wary, and supporters unsure whether the party stands with the government or the opposition, while defending President Ruto's policies on one hand and hinting at a 2027 ODM presidential bid on the other. The enigma of Kenyan politics has unleashed confusion that threatens to fracture his party and cloud the nation's political horizon. Now, here's the thing, by the way, you don't have to go very far for you to find one Raila Amolo Odinga saying that he's going to stand with one President, Dr. William Ruto, all the way to the 2027 general elections. And here's the thing, but we've had these political debates here in the studio where we've seen the support of one Raila Amolo Odinga saying, well, we do not know. We have to wait for him to speak, that we are not in the government. It's only Raila Amolo Odinga and his allies who are in the government, this broad-based government conversation. Now, this is what Raila Amolo Odinga is saying. This is Junet Mohammed, principal within the ODM party, who's saying that all political relations have a lifespan of 5 years. You either renew at the next election or you move on. He has also confirmed that we are firmly in the broad-based arrangements until 2027. Now, 2027 is the year that Kenya is supposed to go into the general election. And probably this is the sentiments that one Raila Amolo Odinga is also expressing in his conversations about that political marriage with one Dr. President William Ruto. Let's see what Raila is saying. This is what he's saying. Stand for what is right for the party and look at what you have signed and remain as an ardent member. We have signed that we will work together up to 2027, but have not passed any resolution as a party to say how we are going into the elections of 2027. Ooh. Yeah? Are they playing Ruto? Isn't it? Or is it us who are looking so much into semantics? Because he did say he's going to stand with one President, Dr. William Ruto, all the way to the 2027 elections. And we do know that 2027 is an electioneering year. Does it stop there, or it extends beyond 2027? That's what one Raila Amolo Odinga is saying. I have not spoken about it. We've not signed any treaty within the broad-based government. What we signed for is to be within this government, that's in a broad-based conversation, all the way to 2027. Beyond that, Raila Amolo Odinga is saying, we've not signed anything into that. We're going to have these conversations on exactly how the 2027 race is shaping up all the way to the time when political parties in the country come up together really to form factions that are going to either win or lose them an election. Good. Let's cross over then and see what Kenyans are talking about this morning before we get into our big conversation this morning. And I can see trending right here this morning as your top trends. I do have one. Here is where we are. Good. Let's talk about this one. Litein Boys High School is trending this morning. And by the way, if you look at the pictures, the aftermath pictures that are coming from that strike of Litein Boys High School, then you wonder exactly where we are. Now, there are allegations currently as we speak, it's unconfirmed reports, that the school estimates that each parent is going to pay 137,000 shillings to get back to school. 137,000. And that's a lot of money. But if you look at the amount of damage that the boys mounted on that school, then it will start to make sense, really. But then you wonder, again, where these images are coming from. Do the boys have mobile phones in school? Because if you look at the videos that were getting recorded during the strike, then you start to wonder exactly where they're coming from. We've seen some boys purportedly in the teachers' quarters who are cooking eggs and chapati. Also seen the bazaar of the school saying that they made up with 2.1 million shillings that was enclosed in that office in form of students' pocket money that was sent to by parents so that it could cater for the students' welfare, and also other monies that were in the form of petty cash within the bazaar's office in that school. Oof, you know? It's just so much, really. And they fall right within Gen Alpha. Now, let's read some of the comments that are coming here. Godi was saying that each student at Litein Boys High School to pay, it's not been confirmed, 137,000 for the damages. That's a lot of money. Means the parents have to start looking for this money again for the boys to go back to school if it's indeed it's true. Juma was saying that those Litein boys are just criminals. Let's not glorify them. After burning down the school, they attempted to storm a neighboring girls' school. The intention was not good. Some broke into the teachers' houses. These are criminals. Really? I mean, you have to think twice even before you start saying this, isn't it? Okay, finally then, on this one, I do have Chris Kante this morning was saying that Litein Boys school parents have been asked to pay 137,000 per student for damages incurred during strike before normal school program resumes. Other schools ordered not to accept any student from Litein High, allegedly. All right. Finally, then, Willis Evans Otieno was saying blanket punishment is lazy justice. What Litein Boys needs is an independent investigation, not collective punishment. Find who planned it, who benefited, who covered it up. Without truth, we only recycle injustice. All right. Justice demands that guilt be individualized. That's one comment here that is coming from Willis Evans Otieno as well on this particular one. Okay, quickly then, let's cross over to what is trending currently in Kenya as well. UNGA Convention, that's 2025. We've had a lot of submissions from President. Let me just speak some of the top quotes that we've seen from that convention. This is Trump who's saying, I don't mind making the speeches without teleprompter because the prompter is not working. All right, whoever is operating this teleprompter is in big trouble. Okay, that's not the main focus of what he said, but then he said that it's good that when we're meeting at these conventions, we speak from our heart. So according to Trump, then he did speak from his heart as well. Good. Let's then look at what he said. He also said that he ended 7 wars in 7 months, even taking credit for stopping the India-Pakistani war. And then he said that indeed that war is again funded by those 2 countries as well. A lot of submissions that we did see yesterday from UNGA as well. Now, this is what he also said, the UN is supporting illegal immigrants coming into the US. He called it a betrayal of American sovereignty, all right? And then says we do have a $372 million in cash support for UNGA as well. Fantastic submissions that we did see yesterday from from that as well, on how they affect the country. I know next week we're going to have these conversations on what this means for the country as well. And I'll be inviting guests in the studio who will be just putting these conversations into proper perspective. Now that essentially forms what is making headlines this morning. We take a tiny breather right here on the morning brief. Once we come back, we're going to have those conversations on the state of our mental health care in the country. Are we in a crisis? And if so, what crisis are we talking about? We do have a counseling psychologist who's joined us in the studio this morning. We take a tiny breather. Once we come back, take out your pens and papers, because after this, there'll be lessons and pointers on what you can do to get ahead in this crisis that has befallen the country. Good morning. My name is Simba Elijah Charles Gage. See you on the other side of this break.
Taarifa zinapochipuka na kutufikia papa hapa kwenye makao makuu ya chumba cha habari cha runinga ya Lookup, kwenye taifa, kwenye serikali, kwenye bunge, tunajitosa hadi kwenye sauti ya wenyeji ili kupata tu maoni ya wenyeji kuhusu masuala haya yanayochipuka.
Maana hii kitu inaenda kuumiza Mkenya kwa tax.
Hakuna kitu tunafurahia. Nothing. Absolutely nothing.
Sisi tunaumia, si ati tunaumia ile ya kiukweli. Juu maisha ni ngumu.
Na bila shaka tunapata maoni yao ili sauti yao ipate kusikika. Na watasema hili, waseme lile, watasema hiki, na waseme kile, almuradi sauti yao ipate taa.
Mambo ya mafuta tena imekuwa ni changamoto zaidi kwa kila mtu wa bodaboda.
Uchumi ikikuwa stable, tunaamini mambo itakuwa sawa sawa.
Kwanza liko na ria wa boda, mama mboga nini. Hao sasa ndio wamefinywa zaidi man.
Mtazamaji, hii ni bunge la wenyeji.
I recall the doctor telling me that day, he said, "Sarah, I'm sorry about what happened to you, but you see, life happens. You would have to learn to work with your hands, depend on your hands more."
And today, if you're going through anything that you do not understand, just call on this name, Jesus, and he will save you.
I realized I loved music when I was about 7 or 8. I used to puff my cheeks and play the 12-bar blues. Like I'd walk around the house doing like...
Why do we need the Holy Spirit?
I mean, if you look at what Jesus said when he was leaving, he said he's going and that he will send the Holy Spirit as our helper.
So God knows everything since the end, from the beginning, has a plan for your life. So to find that plan for your life, you must find God. When you find God, you will know the path for your life.
Do you need a dose of hope? If so, you are in the right place. We think of ourselves around here as hope dealers, delivering truth, power, and inspiration to hearts and minds all over the world. If nothing else has worked for you, why not give the God thing a try? For it's in the presence of God that you'll find everything that you need. Amen.
So topic this morning is how the country is an ailing nation. And we're talking about Kenya's mental health crisis. I'm giving you a couple of numbers here then that are going to paint a grim reality of where we are in terms of recognizing mental illness as a disease in this country. So Kenya is facing a mental health crisis that has moved from private conversations into the public arena. Rising cases of depression, anxiety, suicide, and substance abuse are stretching families, schools, and workplaces, according to the World Health Organization. Now, this is the number. 1 in every 4 Kenyans will experience a mental health issue in their lifetime. Yet stigma and lack of resources keep most from seeking help. Now, the challenge is compounded by a huge shortage of professionals and facilities. Now, listen to this again. With fewer than 500 psychiatrists serving over 50 million people, access to care remains out of reach for majority. Now, only 14% of county hospitals have dedicated mental health units, while Kenya allocates less than 1% of its health budget to this area. At the same time, schools and communities are reporting rising cases of suicide, particularly among the youth. Now, let's talk about what the government is doing as well. Now, the government has taken some steps, including rolling out the Kenya Mental Health Policy 2022-2030 plan and establishing task forces. But questions remain on whether implementation matches the scale of the problem. With the stigma still silencing many and funding lagging behind, experts are calling for urgent reforms, stronger support systems, and a national rethink on how Kenya treats mental health as a priority. Well, then joining us this morning to talk about this health crisis in the country, we do have Meshach Ongoba, who is a counseling psychologist. Meshach, how are you doing, sir?
Good.
Karibu sana. How is Naivasha this morning? Is it as cold as Nairobi?
Naivasha is a bit cold, but here is so much cold.
Yes.
Yeah.
You can tell Nairobians are suffering this morning.
I see.
Karibu sana. All right. Let's put this conversation into a proper scope. Even before we start looking at what our scope this morning is, we are calling it a mental health crisis. And these are the numbers that we're looking at. That if you look at qualified psychiatrists in the country, the ones that are recognized, we don't have around 500 serving 50 million Kenyans. Let's look at the county hospitals in the country that have recognized that mental illness is a disease. We're talking about how only 14 counties have recognized mental health facilities out of the 47 in the country. Our plan was to take us from 2022 to 2030. For those who are listening, 2030 is just 4 years away. Meaning that if only 14 counties have recognized mental health centers, we are way below what our 2022-2030 plan was supposed to achieve as a government. Does that show the level of a crisis that we are as a country when it comes to mental health?
Thank you very much. I think we have, it is true that there is a very high level of crisis.
Yes.
Because if the number of county hospitals or the number of counties that have recognized the importance of mental health issues, 14 out of 47.
Yes.
The progression is so low. So therefore, the crisis is increasing. Actually, by 2030, if nothing is going to be done, I think the crisis will be beyond now what we are seeing.
Yes.
Because from where I see it, what is happening in our country nowadays is more of mental health issues. And most of the diseases people are suffering, actually, they are not so much impactful as mental health issues.
Yes.
So if mental health issues are given the priority it requires, we are heading in a very bad direction.
Yes.
That's what I can say.
Pretty much. And you come in at a proper time, even before we start looking at our scope this morning. We've seen the strikes in the country. Yesterday, I also heard there was one that almost went through for Tengasha Boys High School. as well, and Litain Boys High School. We've seen the massive destruction that has been mad on that school. I've seen a couple of reports, people saying, well, here's the thing, that maybe that behavior is because these boys in the schools don't receive proper counseling services. That for you to see that level of strike and destruction in our school, then there's something that is lacking within the education system. That when there's a problem, or when you guys are stressed, the best way is not to destroy property and then burn property in your school. There are amicable ways that you can go around that. Would you sit there and say, probably, whoever is making those comments this morning might have a point, Meshach?
They have a point. If you do your simple research on how many schools in Kenya have employed qualified counselors and psychologists,
yes,
very few, if they are. Some of them have teachers who have been actually given offices to be like counselors. And you see that is a dual relationship kind of approach, and it is wrong as far as the counseling ethics is concerned.
Yes.
So you should have somebody who is neutral, because you cannot teach students and expect students to come to your office for counseling. Because you'll be having some divided attention.
Yeah.
You see, if the student is cheek in class, when you see the student coming from the door, you have some image. You have some image of that student. Yes. So it will inform your judgment of the issue that the student will be having. So most of the schools have teachers who are designated in those offices to be counselors, and they are not giving the proper counseling that is required. So because of lack of seriousness in our schools, if I can say, it has led to the escalation of such cases. Because if students lack a way of venting their issues, because there is no platform for them to vent whatever they are going through, it is examination. See, the timetable is so strict in school, so they don't have a platform whereby they can air their views. So when they get an opportunity to express especially, you see, those are teenagers, and some of them are approaching 18, 19. You see, they are teenagers still.
Yes.
So they could choose to be violent, because if you are not listening to us, we'll maybe ban the school, will maybe strike, so that at least you can hear what we are saying.
Yes.
So unless we make an intentional step of looking at this issue in a more serious way, that we employ qualified counselors in each and every school, so that they can arrest these issues before they go out of hand.
That's it. Pretty much. Let's then jump into our scope this morning, and this is exactly where we are. That if you look at where we are in terms of digital mental health services and tele-counseling, Kenya is adopting telemedicine and a digital mental health fast. And we've seen exactly how telemedicine reviews show viable models across sub-Saharan Africa, and Kenya hosts growing tele-counseling platforms and helplines. The question that I want to ask is, how can regulators ensure that the counseling meets clinical standards while maintaining affordable scale for Kenya's rural areas? And what's your standpoint on telemedicine, where you can get to call in and speak to an expert?
I think that is the way to go, because the ratio of counselors, even the psychiatrists in Kenya to the population is so small. So the approach of having telecounseling is a timely kind of step.
Yes.
So that we can at least reach so many people. One counselor can reach so many people using technology.
That's it.
So that's the way to go. So we can look at it and see how we can put it in place, so that it can be effective.
Yes.
Because we can have an idea. If we don't have a practical way of executing the idea, then we might not reach our target.
That's it.
So one thing that we can do is because for a counselor to reach someone who is in remote areas, we need connectivity. We have maybe the companies that help us in going online, like Safaricom, Airtel, Telecom, and the rest.
Yes.
They can maybe be subsidized in a way so that they can reach those remote areas.
Yes.
And even the Kenya Power and Lighting Company, they should have power in those areas, because without power connectivity also, such networks cannot work.
That's it.
Another thing that we can do is to intensify licensing, because when the practitioners are licensed, they can be able to have the ethics that it requires, and they can be able to avoid harm to the clients.
Yes.
So if we have proper way of licensing our counselors, like nowadays we have the counselors and psychologists board.
Yes.
That is currently in place, and it is working in close ranges with the Ministry of Health. So it is responsible for the licensing and accreditation of the counselors.
That's it.
So there is something they can do. They can activate the process of licensing more counselors, so they can help in telecounseling. If we have telecounseling and we don't have people who are licensed to take this initiative, it might not work. So that one is something that we can look at, and also we can look for a way of merging the public-private partnership.
Yes.
We have the NGOs that can help, because the government alone cannot manage. So if we have that kind of partnership, and it is so fruitful, it is so warm, that they are able to work together. Therefore, telecounseling will be easy, and we will solve such issues that we are seeing online nowadays. Because if you look at the news, every news item you see, there is an item of mental health that is emanating from that. So telecounseling is the way to go, and I think if we move to that direction, we will make it more practical.
That's it.
Yeah.
The issues that normally come as to why people probably would not go online and start using this telemedicine is on data privacy, because mental health care is such an intimate aspect of illness that even before the patient decides to take that treatment, they are saying, nikienda kwa hii hospitali nienda kusema niko na hii shida ndio nisaidiwe. Am I revealing so much about myself? What is this aspect of data privacy that we have to deal both from the professionals who are in it and the patients? How do we make it clear for both to understand that yes, in as much as you're giving out your data, this is how your data is used and stored to help treat you? Is that an area that we've not tackled as a country, Meshach?
Yeah, it is true. What I think what needs to be done for data privacy to be achieved, we should have proper legislation to safeguard the data that is given by the patients or the clients.
Yes.
Because if I give you my information and you are not so careful on how to take care of it, then I'd rather stay with my problems. So if we have those proper legislation to safeguard this information, therefore people would not fear saying their issues. Yeah, and also we should have explicit consent that these people should be explained to know the risks, the benefits of sharing the information.
Yes.
Because if they don't know, why should I share my information, which are some of the risks involved, so we can mitigate the risks and increase the benefits. Therefore, they cannot share. But if we intensify the informed consent, we sensitize these people on the advantages of sharing the information and their rights to share or not to share. Therefore, they will feel that I have a clue of what my data is going to do. And also, we can think of some cover, some liability cover to in case harm happens. How can we restore the damage that has happened? It's like you are ensuring something before it happens, because if there is a privilege of the information that has been given by the clients or by the patients in this case, and nothing is done. So therefore, the aspect of counseling and healing will be affected very much. So, and also another thing that I think can be done is a proper audit by even the government can help us in doing a proper audit and monitoring of how the data is safeguarded, so they can be able to follow, they can be able to see to what extent is data being given by the patients, to what extent is it harming them. So if the extent is low from their monitoring and audit of the records of the service delivery people, if they can be able to monitor and see there is a way they can be able to adjust, then therefore the patients will be okay, and they cannot fear in giving their information. Therefore, healing will happen.
Very much. Yeah. I gotta be careful when I'm asking you this next question. Meshach, we do know that mental illness becomes a community problem, and currently as it is, you'll find that different people have traditional healers, because this is a stigma-charged illness. You have the so-and-so's kid or family member is going through one day. So you find that some communities have come up with ways to sort of try and help people going through mental health issues. But here we are talking about adopting a national plan. Now, Meshach, do you think that in our 2030 plan, we need to find a way to integrate these traditional healers and different methods of that communities have come up with to deal with mental illness, or we should say, we should only adopt a proper plan, only have the likes of Meshach who've qualified and have gone to school and have studied psychology to come in and only help Kenya attain this plan? Where do you stand, Meshach?
Thank you for that question. I think from what we said earlier, that we have so many Kenyans versus the professionals.
Yes.
For us to reach, because our goal, our end goal is to reach as many people as possible. So personally, I cannot be so greedy not to let some people to help us in alleviating the challenges that people are going through in the community. Yes. So I second that we should have the lay, those people who are called the workers, the lay workers, the traditional healers. Yes. They can help, because from where I sit, before the professional counseling came in, we used to have people who the local people were doing it, only that they didn't know that whatever they were doing is counseling.
Yes. But would you say that they've contributed to making it better? Because I know, Meshach, you've gone to school, you spent more than 5 years of studying psychology and how to approach patients. Do you think that the aspect of modernity would make this crisis in the country end? Because we are talking about us being in a crisis. it so seems like these traditional healers haven't done their part yet to help us alleviate this crisis.
I think there is a way you can work with them.
Yes.
Because as much as we want to maybe send them away from practicing, they are still practicing even nowadays. Yeah, even in our local areas, they are still working, because in a remote area, it's very hard for you to find a professional counselor trying to go and understand the cases they are going through. So those people are in the grassroots. There is a way we can work with them by welcoming them to our platform, and because what they were doing earlier on is an informal kind of counseling. Maybe they were doing some harm, but they weren't aware. So if we can bring them on board and discuss with them maybe the ethics in counseling, that there is consent, there is confidentiality, there is no harm, there is justice, there is integrity. We train them on such ethics so that they can be able to add some value to whatever they are doing. They can help us in alleviating this crisis.
Let's talk about another issue in that as well, and it's a good thing that we started with it this morning. There seems to be a disconnect. There are some people or some areas in this country that would know what there's a mental health crisis issue, schools, churches. How can we connect them to, how can we help them connect them to a sort of hotline where they're able to report these issues before they grow to the levels now we're talking about, like Litain Boys High School case scenario?
I think the bottom line that what we need to embark on is awareness and sensitization. Because connectivity to these areas requires us to send information and relay information, as well as get the information from the point whereby we are delivering the information to. In other words, we should have the feedback from those people. So we should embrace campaigns. We should embrace awareness campaigns to various areas. We can look for ways of reaching these people. We can even use posters. We can have some posters designated in some areas, like if it's in churches, in schools. Let the posters, let them speak on our behalf, because we cannot go every place, so that we can be able to sensitize these people. We can also look for ways of increasing the scope of practice, so that these people can be able to understand the intensity and the importance of the mental health issues.
That's it. Yeah. Pretty much. Meshach, I want us to quickly address this issue, because after we come from our break, we're going to talk about just various ways then that people can start becoming aware of their mental health, like even at the workplaces and even at homes. If you look at our plan to have this area sort of sorted out by 2030, but I was looking at the health budgets in this country, I've not seen it being very clear that a certain percentage of even our SHA expenditure, which is what is being drummed now by the government, is going to go into mental health care in this country. From you now, from where you're seated this morning, what do you think are some of the line percentages of our healthcare expenditure that need to go into mental health care if we're saying that by 2030 Kenya will essentially be moving out of this crisis? Because that's our target.
I think some of the things that we need to look at is the revenue that should go to the crisis intervention as far as the mental health is concerned.
Yes.
We should increase the budget to these people, to these areas. We should also increase the number of professionals, the hiring. We should hire more and train more, because hiring is not enough. We should train them, many of them, so that at least we can improve the ratio. Yes. If the ratio is
psychology,
yeah,
do you believe psychology is an attractive course to new entrants into universities anymore in the country?
Yeah, it is. It is.
But if you only have 500 that are recognized in the country, Meshach, what do you think the disconnect is? Because if you're saying it's attractive, then we should be having more in the country. Do you feel like there's a mismatch? That yes, there are people who go to school and study psychology, but because the government is not stressing on these areas, they would rather employ more nurses in the country. They would rather employ more doctors who are not essentially psychologists in the country to go into the healthcare system.
I think where the disconnect is the from the choices of courses of these students. Yes. Before they go to the university. Yes. What do they have at the back of their mind? You see, they come from their high schools having a picture of the courses they want to do. They normally hear from their friends that you see medicine, engineering, and the like. Psychology and counseling is not so much in their minds. Yes. Why? Even the career counselors in the schools, because they are not there. So no one is sensitizing them on the career choice. They don't know the value of the course that they are not choosing, like psychology. So therefore, having that problem from the high schools, now it goes to the universities. When they go to the universities, they go through the courses, they say, psychology, I don't even know what it entails. I don't see whether I'll be employed. That's another problem. It has gone to the university. Now, it has not been settled. Yes. Now you go to the government. The government has not put the requisite resources in sensitizing people on the importance of such courses. So the government is silent. It is actually making some courses look inferior because they are not even talking about it. Recently, the government is now talking about mental health issues because it is overwhelming.
That's it.
Now, that one has informed the upcoming need for the psychologists and the counselors to be trained.
That's it.
Yes.
Meshach, I want you to hold your point right there, because once we come back now from this break, Meshach is going to be attacking those needy areas this morning. We're talking about youth mental health in the country. We're talking about workplaces well-being. How can we start having those conversations in these places then for us to challenge this crisis in the country? Once we come back right here at Look Up TV.
People are there to belittle you. When people are questioning you,
if you don't move fast, of course, yes, you lose it, but then it's not us to push you.
But you do not know the God who has been molding me. What has he been doing to me?
The deep and mature conversations of empowerment for you with a curious mind and an appetite for oriented conversations.
I concur with what you're saying. You plan your finances, you can easily live without a debt.
An engaging safe space of free expression and truthfulness with an upheld vibrance, motivation and happiness.
So many children who are there, they are not living their dreams.
Join us for deep conversations with Zipporah Gashushe every Saturday from 8 p.m. The Deeper Conversations on Look Up TV.
For you to forgive someone who has hurt you? How easy is it? What are some tips, a person can apply to improve their public speaking skills?
We all have personality lazy somewhere around us.
In my mind, whenever I'm invited for a public speaking event, I don't like to put a lot of, accessories or too many colors.
What are the major things to look out when choosing a school for a child?
Another cheesy conversation starter is, men do this a lot. Men look familiar. Have we met before?
Oh.
We met it. Nobody is buying that line again.
No, we don't. We don't buy it anymore.
Save a Life is a non-profit organization that has taken the front line in transforming lives in the entire country. So far, we have transformed life of over 100,000 people through our programs, which include medical support, youth empowerment, street family program, feeding program, and climate change. Join us today as we transform lives. As we always say, service to humanity is service to God. Save a life, transforming lives.
Still with Meshach Onkoba in the studio this morning, psychologist and a counselor, talking about why this country needs to be very, very serious in putting in strategies that are going to make sure that we avert the current mental health crisis in the country. How bad is it? Only 14 counties in the country have established mental health centers. Now, the country recognizes just 500, serving a population of 50 million Kenyans. That's how bad it is. And then if 1 out of 4 individuals enter into a mental health crisis in their lifetime, then you do see how far off we are in achieving these numbers. So now, let's then stop talking about a broad-based conversation and jump into a specific conversation where I want us to go into youth mental health, social media, and school systems, adolescents facing rising anxiety, exam stress, and online harms. Schools are a key access point, yet many lack counselor and clear referral routes. Now, national data and recent studies have elevated prevalence of depressive and anxiety symptoms among Kenyan youth. So, Meshach, how should the education system and health ministries jointly resource school counseling so every secondary school has a qualified counselor within 3 years? Because that's what we're saying, that we are targeting by 2030, we are there. Let's begin from there. And I know you partly addressed it when we're talking about Litane High School, but this one begins. How can we make sure that every school in the country has a guidance counselor? And do you think that only one guidance counselor per school, let's go an average of 250 students, is enough again for us to say that we are sufficient before 2030?
Yeah, I think for the beginning we can have one. Let us have one in every school first.
For the beginning?
Yeah.
But then, Meshach, that ratio, let me put you on the spot. I've been speaking to a couple of individuals here in the studio who say there's something that is lacking in this country, financial literacy. And then they say we should introduce a course called financial literacy in every school in the country. That way, you're going to have students who come out knowing exactly what they're going to do in terms of the finances in this country. Good. They agree that once you do that, then you've solved that problem. But here is one that is called counseling and mental health. But one against an average of 250 students in a high school, can't you see that we're overloading this individual?
It's true, but this is what we can do. Now that we have a profession on the ground,
yes,
we are very creative actually. Counselors and psychologists are very creative people. Once that psychologist or counselor is on the ground, that one, yes, he can be able to recruit others. We have teachers. We have students. Actually, we have students we call peer counselors. We have a club. So in a school setup, we have an office. We have the head of the office, who is the counselor or the professional in that case, and we have the assistant, who could be the teacher now, who is in charge of guidance and counseling in that school. Now, we have a committee that should be formed now by that office, right? Now, that committee will entail the teachers who have the passion of wanting to talk to the learners about these mental health issues. Therefore, this professional who is on the ground, we said is one, he can be able to teach these other teachers. They can be given some skills. They are not professionals, but because the teachers they are intelligent people, they can learn. So therefore, they can be able to assist this professional in arresting this large number of like 250, 300, 500, 1,000 students. If we have maybe like in our population of 1,000 students, we have like 20 teachers trained by this professional who is on the ground, plus other maybe we have also peer counselors among the students. The menace will be reduced, because if we have a class of 5 streams, we have 2 students in every stream who are peer counselors. It is cascading back to the learners. So 2 students in every stream then come to the class teacher, is also one of the committee members in the guidance and counseling department, and we come to the office now where the counselor is. You see, we'll be arresting. It's a multi-sectoral kind of approach, whereby we can diversify from a single source who knows how to manage these people to the grassroots, who are the students.
That's it.
If we do that, we approach in that way, we could not be having the problems we are seeing right now.
That's it.
Yeah.
There's another area that I want you to address this morning, and I know you've probably met patients who are going through mental stress because of the exposure to social media. It's a big chunk of what majority of psychologists having to deal with nowadays, and especially on these areas, on policies that should govern social media, on content moderation and youth exposure to harmful content in order to protect their mental well-being. And somebody said this, and I keep on referring to the examples we've seen from Lieutenant High School. I do not know where the videos are coming from Lieutenant High School this morning after they did that strike. Them celebrating, them driving the school buses, them burning the dormitories and breaking the windows in their school. And guess what happened? Almost immediately after that strike, a neighboring school, Tengecha Boys High School, almost went into an immediate strike following that content that was released online of Lieutenant Boys High School. Can we talk about that as a country and as a psychologist? Where do you begin when talking about social media causes of mental illness, especially among the youth?
I think there should be some regulation of the information that they access. What information do they watch online? It's a question we need to ask ourselves. Another thing, do they have information of how negative or to what extent can social media affect their lives? So we should start from as low as possible.
Yes.
We teach these students as soon as possible, even from primary approaching to high school. We teach them on the negative negative effects of social media. What content can they watch, and if they have to watch, they should be aware of how they can misuse the media, how this media can be used in a positive way and in a negative way. Like case in point, what you said on the information that was circulating on media that informed the Tengecha Boys to almost start the strike as well. You see, these learners, there is what we call peer pressure.
Yes.
And also there is something we call mob psychology. So, once they saw these clips circulating on media, they say, "Oh, you see, young people, they enjoy doing some funny things that will make them seen by the wananchi."
Yes.
So, They want attention. So they're asking themselves, what can I do for me to be seen, for me to go viral? Let me do something that is bad. Let me ban a school. Rarely can you find students having a video of themselves doing some maybe group work, maybe discussions, doing some inventions, maybe they are discovering something, they are discovering some mathematics formulas, something like that. Very, very rare cases. Yes. Because they don't make them go viral. So these students, because of that mob psychology, they want to do something that can make them be identified, because that's what the crisis is. So in that way, others can say, oh, so these ones are, because they are friends, okay. Yes. Our friends have done this from the other school, oh, we should do that. So, because our teachers are not listening to us. So unless we have the information earlier on, so that these learners know that if they go that way, the online or the digital kind of approach can be able to be destructive to themselves, or it can be positive. So there is a lot of information that needs to be given to these learners at early age.
I was told to ask you this question as well. I remember when I was back in high school, having a phone in school was an offense that would see me get expelled. Actually, that was an expellable offense. But in this day and age, and I'm really speaking on what we saw from Litain Boys High School, where do you stand on these teenagers having mobile phones in their schools in respect to this conversation? And I want you to attach this conversation like this, and it's alleged that what the kids had requested was to be given an opportunity to watch a game between Manchester City and Arsenal. We do know it was happening last weekend. So when that opportunity was denied, then they went on rampage. But then you can actually see the majority of the videos that we're watching are recorded by the students themselves within the school. Where do you stand? Should they have these devices in their schools, but then guide on exactly how to use them? But we're saying that this internet in school, probably it's metered and would only allow you probably to access this and this areas. When you're using that internet, we've seen places in this country where schools, the kids have mobile phones in schools, but then they do not record these things that we're seeing from Litain High School. Where do you stand?
Thank you for that question. I think that one goes back to the information of these learners when they are young. Do they know the value of the phone first? Yeah. How best can they use the phone in adding value to their education? We have the developed countries. We don't have those restrictions. We have the students go with their iPads in class, they go with their phones in class, but nothing is happening because they are sensitized. They are taught from early age on how they can be able to use their gadgets in a more beneficial way. But look at our students in Kenya. They know a phone is used to call, to do some maybe Google online, Google some things that I'm not allowed to watch with the public, for example. Yes. So because of lack of that information, so therefore they misuse. Because if you hide something from a child, they are very curious to know why are you hiding it. So I cannot say that we should allow the students to be having their phones, because I know the destruction has gone very far. If we allow them to have their phones at this level before we give them information, they will misuse it. Yes. So I could wish we start from the awareness, the sensitization of how they can use their phones. So we take them step by step. When they reach a point whereby they can now use their phones without even maybe recording some funny videos where they are dancing, or maybe they are like what happened in Litain, whereby they were touching some their school and even driving their bars, destroying property. When we reach whereby they can use their phones in a more proper way, in a more positive way, we can allow them to have the phones. But as the things stand, we should not allow them unless we teach them first.
Pretty much. Finally, on this question, and I was told to ask you this morning specifically, somebody said that the culture of majority of high schools in the country is uniform. It is stressful, it is exam-based, it is teacher-student-based. That once you walk into your high school, you do know that for the next 3 months, this is a stress area, which also opened a conversation that I was having yesterday on if you allow them to have these phones in school, but then you meter the internet, and then you meter the time that they're supposed to use these phones. Somebody said you will find that they will get used to these devices. These devices won't be a factor to them. Just like you pointed out to other schools, especially in the developed world, where mobile phones is a necessity for these kids even when they go to school, because they got to communicate with their parents. Do you think we need something changed in high school cultures in the country so that we remove this stress, which essentially leads to mental health conversations? Mashak.
Yeah. Actually, there's a lot that needs to be done. Like whoever was saying that we should allow them to have the phones cannot reduce the cases of mental health cases that we have in our high schools. Actually, they use now the phones because they are not sensitized on how they can use the phones in a good way. They can now use their phones to access some hidden information. Because we have some restricted areas that students are not supposed to, like we have videos that are restricted for some age. The students of some age are not supposed to access some information. Because of that restriction, the schools and the school environment, therefore they might misuse the phones. How do I wish that we can talk to these learners? Let us make them friends first. Let us tell them that if we allow you to use the phones, to what extent, how can you use these phones? Let us have a conversation with these learners. Let them tell us how they can use these phones, and let them promise. We can even have a test of them. We can even give them for 1 week or maybe 1 day and see. Then we can have an agreement with them. If we give you for 1 day, if you misuse these phones, we'll take them away from them and you will never see them. If you are responsible for this 1 day, we'll extend to 1 week. Then after one week, 1 month, 3 months. You see, we will make them get used to these phones in a more progressive way. But if we just leave them like that, we flood them with the phones like that. You see, some of them will start calling their guy friends in the village, others be watching some videos where when they are supposed to do some research in class, they are supposed to spend. So we should teach them first, then allow them to access. If we do, we need to have some like a study on the benefits of these funds. Can
Yes.
we add value the performance of these learners? To what extent then you can be able to allow them?
That's it. Yes. All right. Just as for any other person who's watching this morning as well, we are talking about mental health care crisis in the country, and we've really looked at a couple of issues this morning. But Kenya has a very proper plan that by 2030 we should not be talking about mental health being a crisis in the country. We've gone all the way from the education systems. Now we're at that point where we're talking about youth in the country. Now here's the thing, the next question that we're going to get into with Meshach is now on to workplaces. Let's talk about now the mental health of healthcare workers and content moderators. Healthcare workers and social media content moderators face high risk of PTSD, depression, and moral injury. Recent cases of Kenyan moderators diagnosed with PTSD underline the need for workplace protections, one, trauma counseling, and industry regulation. So the question that we're asking this morning is that what minimum occupational mental health standards should be mandated for high-risk workplaces, such as content moderation centers and emergency services, the first one. And the next question that we're going to get into is how the regulators can ensure employers provide long-term trauma care and not just short-term counseling. Meshach, just a very interesting point right there. Mental health issues at workplaces. There are people working in stressful areas. How can we start protecting them? Meshach, I can say that probably my work is also high stress.
All right, maybe that would be another conversation, and maybe so that we see how we can help you. From where I see it, actually people are going through a lot in their workplaces.
Yes.
I think if the employers can be, they lack information as well.
Yes.
What can, actually they don't know. Actually, before we crucify them, we need to give them information first. What they are supposed to do to the employer, to the employees. How can they make the environment appealing to the employees?
Yes.
For example, they can see how they can manage the workload given to these workers. If someone is reporting at 8, they should be given maybe, of course, there should be breaks in between, before lunch. Then after lunch, let them maybe have 2 hours, and they go home. Because most of our employers think that if I have my employees work for a long period of time, then the production will increase. It is wrong. So long as someone has peace of mind, even if you give them 1 hour, they are doing it with a lot of passion. The production will be so high as compared to 3 hours when they know it is a stressful environment, it is like a punishment, you see. So that workload needs to be regulated in a way. Yes. And also, for those workers who are experiencing trauma, for example, why can't we give them a leave? They go and seek therapy, come to us, we talk to them, help them adjust to the issues they are going through, and they get paid. A leave with pay. So if I go on a leave and I'm paid, so I've been healed, and I come back, okay, I'm healed, and I have a pay in my account. Yes. And do you think that is a good way to go? Because I'll feel even my employer is happy about my recovery. But if our employers are so stingy, they don't want to give them maybe leave with pay. They say if you go for a leave, you don't get paid. You see, if you maybe you get into maybe depression or maybe PTSD, nobody is talking to you. There is no assessment. Maybe no one is doing any assessment. Somebody is going through a lot in the place of work. The employers are keeping quiet. The production will go low.
Yes.
Yes.
I was told to ask you this question, and this came from a nurse who saw your poster yesterday. I should call her. She said I should say hi this morning. Hi, Annie, how are you doing? Hopefully you're watching Meshach this morning. And this is what Annie told me to ask you. She works as a nurse in one of the level 5 hospitals in this country. And then she told me this, Meshach, that one thing that I've never gotten over is that in a normal day, I can see 6 patients dying at my hands when we are trying to give them health care. She told me that to her, death, even when they were taught in class, this is exactly how you need to face death, that your patients are going to die. She's telling me that this keeps her awake, that she's never viewed death as a natural thing in her profession. And she also told me that she lost her parent just before she went into nursing. So for her, death means more than failed medical care. And then she tells me, from a personal perspective, could you ask Meshach what I need to start asking my employers to do to me, or what I need to also start doing to get over this stress? Because she says it stresses me a lot. It's something that hangs at the back of my mind. What do you think she needs to start doing, or what does this hospital need to start doing for people like Annie this morning?
Thank you for that question. Actually, it's a good question that needs to be heard by the health managers, the employers in various health departments.
Yes.
These people are going through a lot. What needs to be done, one, is to regulate their workload. If someone is seeing six patients, 6 deaths actually, in a day, what if you regulate the number of work they do? In addition to that, allow these people go for peer supervision. Allow them go to someone to talk about their experiences. Let them vent their frustrations. So if they don't vent their frustrations, they keep on piling. They'll have a burnout, and the production will be low. So we should allow these people to, actually what I call it self-care. Let us allow these people. We can even give them a leave. Like if they have worked for 5 days in a week, give them a leave, like 1 day off. There's no maybe an emergency call from the workplace. There's no any other assignments, take-home assignments. Let them go and relax. Another day they can maybe think of calling a mental health expert to come and talk to them. The whole day, no work. Let them sit down, share their frustrations. Let them ask their questions. Let them seek guidance on how they can handle such issues. So, like the one who has asked Anne, you said Anne has asked a question. I think she needs to tell the hospital to actually come out with a plan. They can seek advice from the psychologists and the counselors like us, and we can give them a good plan on how they can take care of these the employees. Let them have some seminars scheduled within maybe once in a week for their welfare. Maybe a mental health awareness. Let them go for a team building activity. Let them go jump, hide, laugh, and the like when they come to work. That one will help them to release a lot of pressure from within. If nothing is done, it's only Monday. It's Monday to Monday. Like the nurses and the doctors, they don't have. I don't know whether they have a holiday or maybe they have a weekend. They are on duty every time. So because of that pressure of work, yes, it is work, and there is overtime. You see, of course, as much as you are looking for money, if your mental health is not taken care of, money cannot help you. You can be mad. You'll be mad. At the end of the day, you'll be mad, and you have a lot of money in your pocket. How can you use the money and you are insane, for example? Yeah. So a lot of things need to be done.
Ashak, as we clear this conversation this morning, I want you to take 2 minutes. I know that people are listening to you this morning. You've really touched on a lot of issues this morning. And once I call you back, maybe now we shall be zeroing in on particular issues that people go through. Today was just an introduction of where we are as a country in terms of mental health care crisis. For anybody listening to you this morning, and they're saying, I think I need help, what would be your advice to them this morning? Where do they need to start from? And what is this one question that they need to ask themselves this morning to either say, I need help, or I do not need help, as we clear?
Thank you. The one question they need to ask themselves when they have an issue is, where can I get the help? Where can I get this help? It is either you go to the hospital. That's why we have counselors, psychologists. Some of them are there. They can give them a roadmap on what they need to do. So the question they need to ask themselves is, where do I get help? So if they get the question where, then now another question comes in. How can I know whether I need help? They need to ask themselves, how am I feeling? Am I feeling tired? Do I feel angry? Do I feel weak? Do I feel like dizzy? Do I feel sleepy? Do I lack appetite? Do I feel like I need to sleep the whole day? Those are some of the signs that should inform them to go and seek help. It's not late. They can seek. Actually, nowadays we have online platforms. They can't meet someone who knows a counselor, a psychologist. Nowadays, the number is increasing, so they can get someone to listen to them, have them find out, have a diagnosis of the issues. They can refer them if the issues is beyond their control, and they'll be helped. Yeah.
Pretty much. So do not seek help. That's the message this morning.
Yeah, sure.
Ooh, Mashak, thank you very much for coming by, man. This has been such a lovely conversation. I'll call you back again because under mental health care, there's so many issues that we need to jump into so that we can guide people then on what you need to do to start removing yourself from the many Kenyans who are suffering mentally. Thank you very much for coming by. Taking back online to the time that he joined us in the studio at Lookup TV across all your social media platforms. If you have any other questions, just like we do, we're gonna sample some of those comments and suggestions and send them to Meshach, just like we do here on The Morning Drift. My name is Simba Elijah Charles King. I guess see you another day for another conversation. Goodbye and good morning.